This is EkG and infarction lesson, and lesson number is 28, page number 3, in continuation with previous 2 pages. Now, if the coronary blood flow is severely compromised and the myocardium is injured, then the ST segment is elevated, and this is a sign which should never be ignored any time, because sometime in diabetic patients and other patients, the patient may not complain of chest pain or anything, and you find suddenly elevated ST segment. So you should not waste time when you see ST segment elevated, and the elevation of ST segment is showing convexity upward, with upward convexity. This is a scooped appearance or coved appearance. This is an important sign of infarction. Now, then the question arises that why there is elevation. The physiological explanation, these are all explanations, is that when heart tissue is damaged, healthy tissue is damaged, the ST segment is elevated, and in the normal person, the outside is positive and inside is negative. This is normal. And when it is depolarized, when it is injured, the outer surface becomes negative. Even in the partial depolarization, there is leakage, and this causes negativity outside, positivity inside, and flow of current, and this is known as injury potential. But in injured surface, as I told you, between the uninjured and injured portion, there is a current, flow of current, and the depressed based line returns to the normal and giving a false impression of the ST segment elevation. Now, let me go through why the ST segment is elevated with the help of the diagram. Now, remember that ST segment, that is S to the beginning of the T, ST segment is during this period, this is fully depolarized, and from T to P it is fully repolarized. So this portion which is depolarized is signified by the ST segment. Now, when a part of the surface is injured, it is negative, and uninjured is positive, and this will cause flow of potential, flow of current. Now, then let me show you this diagram, the lower diagram. So injured portion is negative outside and positive inside, and such condition is known as injury potential. Now see this diagram. Normal base is dotted line, and injury potential shifts the baseline down. Dotted is the normal baseline, and this is shifted down when there is injury. The base shifts down, so the shifted area is the downward. And then what happens on depolarization or stimulation, the surface, the depolarization, the surface of normal myocardium will be negative on the on the surface, as well as injured myocardium is above, is also negative. Injured portion is also negative. So when you depolarize, depolarization means negative outside, positive inside, and a injured portion is already negative from on the surface. Now no current is flowing and the baseline will shift up. If there is another beat, another contraction, no flow of current will take place when it is depolarized, because the damage will also have negative outside. So no current will flow and the baseline will shift up. As you see here, baseline has shifted up to the zero, normal level, and this gives impression of a raised ST segment. Once again, the injured portion is showing negativity outside. Normal also, when depolarized, will show negativity outside. So no flow is taking place. The injury potential, when it is generated, it shifts the recording from normal baseline to down. As you see here, arrow, when injury potential occurs, the baseline is shifted down from normal. When on a stimulation, the surface of the normal myocardium will be negative and there is a negativity in the injury zone. No flow of current is taking place. When no flow is taking place, the baseline will shift up. Baseline will go on up, and this gives an impression of raised ST segment. So this is the explanation of raised ST segment. Thank you.